The STERIS Integrated Patient Warming System is designed to assist you in achieving and/or maintaining normothermia for your surgical patients, including patients aged 2 or older. This system is not recommended for patients under the age of 2. The system provides conductive warming to the patient. It begins working as soon as patients are transferred onto the surgical table because it works through contact with the patient's skin. Before we go through the system, I want to briefly describe our system's intended use and explain why STERIS developed this product. We know that even with existing warming protocols, too many patients still experience unintended hypothermia. It is recognized that providing active warming as soon as feasible assists in mitigating hypothermia and known causes of heat loss in surgical patients, namely the induction of anesthesia, which is responsible for a large portion of initial heat loss. This system works as an adjunct active warming to complement your current warming practices. It allows you to start warming in a way that will not impede your ability to prepare the patient for surgery because it's integrated, unobtrusive, and does not use air. During placement of monitors and lines to the administration of anesthesia to positioning, your patient will benefit from integrated warming. We call this a warm welcome from the start. Finally, we believe that the warmth provided to patients will improve their experience in the operating room during the time that they are awake and often feeling cold. This system is composed of 3 components: the torso pad, which replaces the traditional table pad, the system controller, which controls both the torso pad and an overbody blanket. The overbody blanket is optional. Let's review each of these 3 components. The torso pad is 3 inches thick and has the pressure relieving properties that exist on our other table mattresses. Place the pad onto the surgical table in normal orientation with patient side up as indicated on the pad. The pad has markings to identify the heated versus non-heated area as well as the sensors. The patient's skin must come into contact with at least one sensor. The sensors are used to provide the system with temperature feedback, and at least one sensor must be in contact with the patient's skin in order for the feedback to occur. The sensors have been placed in a manner that makes this easy. There is one cord that connects the pad to the controller. A thin barrier should always be used between the pad and patient. Typically, this will be a sheet. The controller is small, lightweight, and can either be mounted to the surgical table at the side rail or mounted on a pole such as an IV pole. When mounting to the IV pole, ensure that the pole is placed between the 2 sides of the bracket and tighten the bracket. Be sure not to insert the pole too far into the bracket mechanism. The controller also has a standard power plug, as well as the following accessory connections. One blue connection that's used for the torso pad. The pad has a blue coloring at the end of the torso cord to help you remember the correct connection. There are 2 gray connections. The gray connections are interchangeable and are used for the overbody blanket. The remaining gray connection is available for potential future products. You will only use a maximum of 2 accessory ports at this time. The controller interface has a graphic screen and the following buttons: power button, temperature selection buttons, and the alarm mute button. We will review the graphic screen once we have the system set up. The third component is the optional over-the-body blanket. It is designed to be used either with the torso pad or as a standalone warming blanket. The overbody blanket has similarities to the torso pad. First, please note the markings on the blanket. The top side marking indicates that this is the side that should be facing up. The opposite side has markings in the same location that say patient side. This is the side that should be touching the patient's skin. You will also see the markings indicating the location of the sensors. Just like the torso pad, it is important to ensure that at least one sensor is in contact with the patient's skin. Only place a thin sheet between the blanket and the patient's skin. This thin barrier is required, but any thick, multi-layered material can impact the sensor's ability to provide temperature data to the controller. The overbody blanket has a gray cord that connects to either of the gray receptacles on the controller. Please note, do not fold the blanket in a manner that precludes at least one sensor from making contact with the patient's skin. The three S's that will help you remember important operating instructions are: 1. Sensor. At least one sensor must be positioned over the patient for proper temperature control. 2. Surface. The overbody warming blanket surface labeled patient side is the heating surface and needs to be facing the patient. Do not have the blanket surface labeled top side in contact with the patient. 3. Sheet. Do not have any material more than a thin sheet or gown between the patient and the overbody blanket. Proper positioning of the overbody blanket is important for temperature control. Typically, it'll be used as a lower body blanket, an upper body blanket, or can be folded in half to cover the shoulders and arms. It is suitable for supine, lateral, prone, and lithotomy positions, including variations of these positions. We will review proper positioning during this video. You may also refer to Section 2 of the Operator's Manual for detailed positioning information. Finally, the overbody blanket has a max temperature of 38 degrees Celsius. Attach the controller to either the side rails of the surgical table or to an IV pole. Plug the controller into a standard wall outlet. Attach the blue cord coming from the torso pad to the blue accessory port on the controller. Attach the gray cord coming from the overbody blanket to one of the gray ports on the controller. Let's review the controller interface along with its messaging. To begin, press the power button. Note that an alarm sounds momentarily while a self-test is underway, and the screen depicts a spinning wheel. Once complete, you will see the default setting of 37 degrees Celsius glow green, and the body graphic will appear on the screen. There are 5 available temperature buttons that can adjust the temperature. Simply press the desired temperature button. If the unit is turned off and back on within 10 minutes, it will default to the temperature that was last selected. If it's turned on after 10 minutes, it will default to 37 degrees Celsius. The alert mute button allows you to pause the audio alert while troubleshooting. Later, we will review common troubleshooting examples. On the controller screen, you will see a body graphic showing that the accessories are plugged in and recognized by the system. A green wavy line appears at the depiction of the torso pad as well as the depiction of the overbody blanket to indicate that the item is connected to the controller. A solid black line indicates that the accessories are either not connected or not being recognized by the controller. The green wavy line indicates that the system is either warming or cooling. This is accompanied by a text box that will indicate one of 3 messages. 1. Below temp. This simply indicates that the unit is heating. This will continue to show until the selected temperature is reached. Once the selected temperature has been reached, then the text box disappears and the striped graphic turns solid green. 2. At temp. This indicates that the system has reached the selected temperature. This will be accompanied by a solid green line. 3. Above temp, accompanied by a wavy green line. This is simply an indication that the system is managing temperature to the desired temperature selected. If this is not accompanied with a triggered alert, then it is safe to use. A yellow line indicates that there is a fault condition. We will review fault conditions in a moment. Let's review the system usage. This system is only intended to be used in procedural settings. All components of the system are reusable and can be wiped down using the disinfection agents listed in the operating manual, section 5.2. It is recommended that any disinfecting sprays be applied to a cloth and the cloth be used to wipe the system down. Follow all cleaning product instructions for use. Because the system is conductive, there are radio-opaque wires that will be seen on X-ray. Arrow markers will also be seen to indicate to the reading radiologist or surgeon the location of the wires, and this should not impede the ability to accurately read any X-rays. Let's review some of the system messaging that you may encounter on the controller. Accessory failure. This is both a visual and audible alert. Verify that the indicated accessory connector is properly plugged in. Verify that the gray-tipped cord is plugged to the gray connection and the blue-tipped cord is plugged to the blue connection. Unplug and replug the indicated accessory. If this doesn't work, then the accessory may need to be replaced. Configuration fault. This is a visual alert. Verify that only one overbody warming blanket is plugged in. Only one can be used. Disconnect each accessory one at a time to determine which accessory is producing the error. Replace the faulty accessory. Controller fault. This is a visual alert. Power the controller off and then back on. If the error persists, the controller will need to be serviced. Replace battery. This is a visual alert. Turn controller off and then on to run a repower cycle. If the error persists, then the battery needs to be replaced. Unidentified accessory. This is a visual alert. Verify accessories are STERIS accessories for the patient warming system. Disconnect and reconnect accessories to see if this resolves the fault alert. If the fault persists, then remove from service for possible repair or replacement. Max temp shutdown. This is a visual and audible alert. Verify that both the overbody blanket and the torso pad are installed properly. Give the system a few minutes to recover automatically. Please note that this can occur due to either the improper folding of the overbody blanket or folding that occurs after the system has reached a set temperature. This can also occur when the overbody blanket is placed on top of the torso pad during setup and prior to patient being placed on the surgical table. If this persists, replace the accessory causing the fault. This can be determined by unplugging the accessories one at a time to see which is causing the fault to appear. When the audible alarm comes on, the user may mute the alarm by pushing the mute alarm button. This will mute the alarm for 10 minutes. If the system has not cleared the alert, the audible tone will sound again after 10 minutes. You may continue to mute the alarm every 10 minutes. While muted, the alarm button will flash, letting you know that an alarm is present and muted. Now that we have the system set up, let's review some of the operation and patient positioning. First, select your desired temperature on the system. Remember that this temperature reading displays the temperature of the pad and/or the overbody blanket, not the patient temperature. Frequent monitoring of the patient temperature should be done as per your facility's policies. The patient temperature monitoring device is the indication of patient temperature and is used to determine interventions to achieve normothermia. The torso pad will function just as any other table pad, except that it has integrated warming. It will work best when as much of the patient's body as possible is in contact with the torso pad. As per usual with all table pads in the facility, a sheet will be placed on top of the pad prior to placing the patient on the table. When we state as much of the patient's body in contact, we understand and expect that there will be a sheet between the pad and patient. This should not affect the contact the patient's body has with the pad. The contact is occurring through the sheet. If positioning accessories are placed between the patient and the pad, this will reduce expected warming as significantly less of the patient's body is in contact with the pad. It is still fine to use these types of accessories with the patient warming system, but it will be less effective due to the added barrier of an accessory between the patient and the warming pad. Once the temperature is set and the pad is covered with a sheet, then the patient is ready to be transferred onto the table. The torso table pad should not be folded. As previously stated, the overbody blanket is an optional accessory. The torso pad works as a standalone warming system. When deployed, the overbody blanket provides additional warming. It is placed on top of the patient using a thin barrier such as a sheet between the patient and the blanket. You may also choose to cover the blanket with other materials such as cloth blankets. If this is done, ensure that you cover the entire blanket with the materials. This will make sure that the sensors are covered. Please note that the overbody blanket is not intended for underbody use and should not be placed under the patient. Remember that the patient's side is to be placed in contact with the patient's body, and the top side will be the side facing you. The blanket is not intended to be wrapped around the patient. Only place the blanket on top of the patient with top side facing up. Just like the torso pad, the blanket works best when as much of it as possible is covering the patient's body. As is the case with the torso pad, a thin barrier should always be used between the patient and the blanket. Here are the typical placements of the overbody blanket. As a lower body blanket in any patient position, as an upper body blanket in any patient position, as an arm or shoulder blanket. For this position, it is acceptable to fold the blanket as long as you do not fold over a sensor. As you can see, this system is easy to use, has intuitive setup and operation, and can be used for just about any case and patient position. We suggest that the system be turned on and set up at the beginning of the day and left on throughout the day. It can remain on during routine room turnover cleaning as well. Please note that the pad may not feel warm to the touch until a patient is transferred onto the surface of the surgical table. Once on the table, the patient will feel the warmth right away. Take care of your system by avoiding the use of sharp objects that can puncture or tear the system. The materials used are similar to standard table pads and need the same care. This system is a great adjunct warming intervention to help you achieve and maintain normal thermia for your patients. It can be used in conjunction with your normal, active, or passive warming protocols and with any other warming systems. Finally, as with all corded equipment in the operating room, lay the cords flat and out of the way to reduce tripping hazards. We offer an all-in-one user's manual that gives detailed information on everything we reviewed today, including a patient positioning guide.
Thank you for your participation in the STERIS Patient Warming System in-service. If you have any further questions, please feel free to contact your local STERIS representative, and we will be happy to assist you with your request.